Hi everyone, we are going to continue on our rash series and we're going to talk about molluscum. Now molluscum is a rash that's common in children and they're very much like warts in that they are isolated little spots, usually sometimes just one, sometimes clusters of them, and they last for a long time. They are caused by a virus. It's the pox virus family, but it's not like a virus where it causes like coughs and colds and acute illnesses. Like I said, it is actually clinically looks like one isolated spot or what we call a papule, or sometimes small clusters of those papules. And they look like white or pink or even flesh color, and they're usually firm and pearly or shiny as we call it, and the center is umbilicated or what we call indented. So it's a classic look, and so it's usually diagnosed clinically by your provider. Now, it is spread by close contact, so skin to skin, and so risk factors are, of course, playing close contact sports, sexually active, and then also our immunocompromised children are at increased risk. So when we're looking at molluscum treatment options, first and foremost, if the child is healthy, no immune issues, then we opt not to treat and we just monitor, as majority of time molluscum is self-resolving, can take 6 to 12 months and sometimes even up to 2 years. But we do consider treatment, or we actually say let's go ahead and treat in those who are immunocompromised, in molluscum that are sexually transmitted, but then also if there's any cosmetic concerns where you're noticing psychological stress on the family or the child themselves, or if you feel like there's an increased risk of transmission, so if the child is playing close contact sports. And then lastly, of course, if the molluscum is still continuing to spread where you're seeing more and more clusters and you're seeing 20 to 30 lesions, then we do opt to treat. So treatment options include physical removal, and that is the most effective and proven method. And those include actual physical curettage, which means actually physically removing the molluscum by the dermatologist. The second one is cryotherapy, which is using liquid nitrogen to what we call freezing off those lesions. And then last is cantharidin, and that is a chemical that we apply to the lesions and the area blisters up and the lesions disappear. Now, all of these methods do have a risk of pain and then also have a risk of scarring. So please discuss with your provider the risks and benefits before deciding the options. So there are other less invasive treatment options, but they are not as effective or even proven effective in children. And so please discuss them with your provider before using them. And then a list of them include imiquimod, podophylotoxin, salicylic acid, topical retinoids, and even potassium hydroxide, and there's also 10% benzoyl peroxide, and even myrtle leaf extract. Because they're experimental, the way we use them, the frequency of use all vary. So again, please talk to your provider before you decide to use them. Prevention is also very important. So once your child does have molluscum, you want to make sure that they're not scratching it or picking at it, as that increases the risk of transmission, not only to others, but also just spreading it onto other parts of their body. Also, cover the lesions when they're swimming. Avoid co-bathing. Avoid sharing towels or sports equipment, and then also trying to limit that close contact sports while they have those lesions. But most importantly, they do not need to be excluded from school, because remember, this is spread skin to skin close contact. We thank you for listening, and we'll see you next week.